Hi there. My name is Laura Lundquist. I'm a physiotherapist and owner here at Zoomers Physiotherapy and Health Solutions. I'm so excited that you've decided to take a minute or two to listen to me chat about the importance of exercise and movement in the context of hip and knee osteoarthritis, and how the GLAD program, which stands for Good Life with Osteoarthritis from Denmark, because that's where it was developed, how that program can be really instrumental in helping people who are managing the symptoms of hip and knee osteoarthritis get a better handle on their symptoms, take some control back, and continue to enjoy all the things that they love in life. So if you have been struggling with hip or knee osteoarthritis, stick with me here for a couple of minutes to learn how this program or our other services here may be of help to you. A little bit more about me first. Like I said, I'm a physiotherapist and I've been practicing since 2003. I work in orthopedics and have worked a lot in sports over the years, but my real passion is getting people back to active living, whatever that means for them, whether that's sports participation, going for a walk, doing your gardening, or just doing the house cleaning and that sort of work is all physical activity that requires the best out of our body. And so I was really excited to begin Zoomers, Open Zoomers in 2018, and then to be the first clinic in Nova Scotia to offer the GLAD program, as I really feel it is of such value for people with hip and knee osteoarthritis. So let's get to it. What exactly is this GLAD program? Well, it's a 6-week exercise and education program specifically for people with hip and or knee osteoarthritis. It's an evidence-informed program, which means it's based on the research that's out there that tells us that exercise and education should be mandatory treatment for everyone with hip and knee osteoarthritis because they have such good rates of success in terms of helping people feel better and do more. And the goal of the GLAD program is to improve each person's self-management of their symptoms. So again, they're able to get the most out of each day of their life. The nuts and bolts of the program is that you always begin with a physiotherapy assessment, and that one-on-one time allows you to make sure that the physiotherapist really understands your body, your joints, and what you're able to do. And after you've had that session, then you're able to enroll in the GLAD program. And the GLAD program itself involves 2 education sessions as well as 12 exercise sessions that are supervised by physiotherapists and done in a group environment. So often you come in and we do them either in the clinic together as a group, or sometimes you can also do it virtually where you join in from home but within a group setting just from home. And like I say, there are 12 exercise sessions, and they run generally over a 6-week period, usually with a week or 2 of makeup classes in case something gets in the way. But best bet is to try to hit 12 exercise sessions over 6 weeks. And the exercise program itself is done in sort of a circuit style. So there's a number of different exercises that each person will do, which again, there is a bit of a template, if you will, of the exercises that are the base of the program. But then of course, each person has their own individual history. You may have hip or knee osteoarthritis, but also a back that you manage, or an old ankle injury, or a shoulder that you need to be cautious of. So the information we get in that physio assessment really allows us to understand what the best choice of exercise is going to be for you, for your whole body, not just for your hip or knee. So then you've got your program and you're ready to roll. And then, there we go. And then these would be some of the exercises that we would do. And the great thing about these exercises is that they are easy to do at home once you know how to do them properly. So it is really important to have good supervision. When we're doing the exercise programs in the GLAD, we talk about neuromuscular exercise, which means we're not just thinking about making a muscle stronger, but we're thinking about how does that muscle work to support my body, and what position and alignment should my body be in while I'm exercising, and then also when I'm moving around in everyday life. We want to take that strength and alignment awareness and translate it into how you're moving throughout your day. That's ultimately how the GLAD program is effective for people. So we do strengthening exercises for the front and back of the thigh muscles, so the quadricep and the hamstring muscles. We do strengthening for the gluteal muscles, or in the buttock, as well as for the abdomen and the low back, because we know that all of those muscles together is, it's the importance of having the balance of those exercises. The balance of that muscle strength in order to be able to move again efficiently through your day. Just about every physio's favorite quote is motion is lotion. And we know that for osteoarthritis, there is no exception here. It's important to know what movement is right for you and the amount of motion that is right for you. And again, that's where a physiotherapist's expertise can be really helpful in helping you understand that about your own body. But movement is key. Motion is lotion. It helps our joints stay as healthy as possible. And again, helps us do the things that we want to do. There has been some research done in terms of the results for clients who have gone through and done the GLAD program in Canada, so not just here at Zoomers, but across the country. And what we see is that after that 6-week exercise and education program, there's an average pain reduction of 30%, which is significant. It also means often that there's less reliance on pain medications. People typically are able to walk faster and have increased leg strength and leg power. Also, there's a much less fear of damaging the joint with activity, which really allows people the freedom to do those things that they want to do. When you understand how to interpret how your joint is feeling and how it reacts to things, it gives you a little bit more confidence to move forward and choose to do activities that you want to do. And then we also see that people have a significant improvement in terms of their reported quality of life. And ultimately, that's what it's all about. The GLAD is different than just going out and getting some regular exercise, again, because we do an hour of exercise for the hip and knee in each of those sessions, that volume of targeted exercise is typically more than most people do. Also, it really is isolating to the muscles that are very specific to supporting hips and knees with osteoarthritis. And that focus on neuromuscular control and alignment is the key factor in terms of making sure that the strength training you're doing actually translates into how you feel again as you move around through the day. And the real focus on education, understanding your body, and then being empowered to go forward and do what you want to do is what those are the things that make the GLAD a little bit different from just a regular exercise program. Is the GLAD right for you? Well, if you have symptoms of or a diagnosis of hip or knee osteoarthritis, the chances are it probably is. It's important to make sure you don't have any other medical issue preventing exercise participation. But again, that's where the assessment with the physiotherapist at the beginning really helps us identify whether or not people are a good candidate for the program. Sometimes there's some other issue that needs to be managed first before you're able to participate in that rigorous exercise program, which again, I say rigorous, but it is always tailored to the abilities of the person, right? So we want to challenge those muscles to get stronger, challenge your alignment to be better, but always within what is reasonable for each individual. And then, of course, you need to have a willingness to engage in a regular exercise program because that really is the foundation of the GLAD. If that sounds like a good idea to you, we'd love to hear from you. You can reach out to us here at Zoomers at admin@zoomershealth.ca, or you can give us a call. Our front desk reception would be happy to take your name, number, and your level of interest, and then one of our physiotherapists here will reach out to you to chat about whether or not it's a good fit for you. 902-453-1525. You can also go online to gladcanada.ca because, like I say, this program is not just unique to Zoomers, but is offered across the country. You can get lots of great information and more information about the GLAD program there, again, at gladcanada.ca. Thank you so much for sticking with me for a few minutes here. I hope you've learned a little bit. Remember, motion is lotion, but it's important to get some advice to understand which motion is going to be your lotion. Talk to you soon.